Welcome back to Studio 701. You may have heard of getting adjusted and the benefits it's going to have on your overall health.
That's right. And we're going to have a live on-air adjustment right here in the studio. First up, though, we'd just like to welcome Dr. Mason Custer and Chelsea Peterson. Thank you both for being here today, and Zyla, of course, too.
Yeah, thank you so much for having us.
It's our pleasure. So first off, let's get into what chiropractic care is exactly, and what can some of the benefits be for?
Well, chiropractic care deals with treating the spine as far as spinal misalignment goes. A lot of times through daily activity, our spine will misalign, and misalignment means going posterior, rotating, and usually tilting. So what a chiropractor does is it resets that vertebra so that the nerves that come out of each segment can function properly into its highest potential.
Okay, and who do you recommend sees a chiropractor?
There's no recommended age. I mean, I've seen my babies when they're hours old. I've seen all the way up to a 96-year-old patient. So the benefits of chiropractic are wide-reaching and are not restricted to a certain age group or setting.
Okay, and so Chelsea, she's here to help you show what adjustment might be like. So maybe can you take us through the process while you're doing the demonstration?
Absolutely, I would love to. So what a chiropractor does is he usually initiates the encounter by, how are you feeling today?
I'm feeling all right.
Okay.
Woke up with a slight headache that has subsided, but I'm still feeling pressure in the back of my head.
Okay, in the back of your head. No headache though, that's gotten better?
Yes.
Okay, so usually headaches can come from the upper neck vertebra. The muscles that attach to the upper neck vertebra also connect to the covering of the brain. That is where the sensation of a headache comes from. So when I hear that, I'm usually after the atlas and axis, which are C1 or C2. Chelsea here is displaying a C2 subluxation on the right side. So what I will do is I will set up on the right, I will tilt her head over, I'll rotate it just a little bit, and I'll put just a little bit of force into it. It's more like a bump, boom, like this. Okay, so if we look at the dry spine here, it looks something like this. Over to the side, through. Okay, that's the correction. So we're gonna actually do that here now for you. If you just sit all the way back, nice and tall, display that nice posture. So we're gonna go over to the side, rotate, adjust.
Yeah, I heard that. All right.
I felt
Massage that
that
out a little bit. There you go.
Wow. Okay, so you're saying that I guess the spine can maybe, when it misaligns, it puts pressure on a nerve, and what you're doing is helping to relieve the pressure?
Between each segment, if you can see on the spine here, there's nerves that come out of those vertebrae, and when those are affected, it can affect organs, muscles. People oftentimes will have stomach issues, and if we look at the chart here, a lot of times T6 comes into play or around it, and that can cause stomach pain. We'll go here, T6. Stomach troubles, including nervous stomach, indigestion, and heartburn. So a lot of times we can help patients with that and help them alleviate those problems.
So having that adjustment, I mean, how quickly might she see some results from having just one adjustment, or when should she maybe come back for another?
Usually it's patient specific. Hers was pretty bad today. She should start feeling relief immediately. A lot of times, you know, those muscles will start releasing and you're able to function more properly right away. As far as coming back, we kind of leave that to their discretion, but give a solid recommendation on when we should see them again. For Chelsea, I would say within a week, we'll see how things are going and go from there.
Wow. Overall, I have a question. What do you wish people knew about chiropractic care? They might go in with ideas in their head of what it's about, but what do you wish people know about it?
That it's more for just neck pain, back pain, lower back pain. Your organs, your overall well-being, your stress levels can all be alleviated from proper chiropractic care. From your spine being in alignment, everything flows better, and you're just less stressful.
Wow. All right. Well, guys, thank you so much. That was pretty cool.
That was really cool.
Yeah.
That was a first on the show. Good job, Chelsea. You were able to relax live on television to get that adjustment. Good job.
Thanks so much for being here, guys.
Yes, thank you for having us. Appreciate
Absolutely.
it.
So if you have questions for Dr. Mason of Mason Chiropractic Clinic, you can go to masonchiropracticclinic.net. They have locations in Bismarck and Dickinson. You can schedule appointments online, or you can give them a call at 701-751-1314. Dr. Mason welcomes walk-ins as well.
Don't you just want to, like...
I need to walk into our studio right now.
I know. I want that now.
Maybe give us a little adjustment before you leave. I don't know. Just saying.
All right, well, still...